to talk more about whether June 21st is going to be Freedom Day or not, we're joined by the government's independent advisor on COVID and ethnicity, Dr. Raghib Ali. Dr. Ali, do you think that progress along the roadmap has now been derailed by the Delta variant?
Good morning, Trevor, and thank you for having me on the programme this morning. Just before I answer that, Trevor, I just wanted to mention something about the general approach that I've taken throughout this pandemic as to whether we should have ongoing restrictions or lifting restrictions. And the approach I've always taken is that we have to look at the overall kind of benefits and harms of a particular policy, and we're trying to minimize overall harm. So, of course, there are potential harms from COVID if it's allowed to get out of control and cases and hospitalization and deaths increase. But of course, there are also potential harms from ongoing restrictions. And over the last 18 months, I've consistently called for restrictions generally to be lifted earlier, particularly last summer when I felt that schools were closed for too long and we could have reopened sooner. So having said all that, it's true that the situation has really changed over the last 2 weeks. I mean, 2 weeks ago when I was asked the same question, I said it was just too early to tell. We needed to look at what data would materialize over these 2 weeks. But unfortunately, over the last few days, what has become very clear is that cases, because of the Delta variant, which really has transformed the situation, cases are increasing rapidly, doubling almost every week in some places. But the key factor is now the hospitalizations are also increasing. Fortunately, not at the same rate as we saw back in waves 1 and waves 2. But they are increasing at a sufficient rate that we need to be very cautious going forward.
What would you like the Prime Minister to say when he speaks tomorrow? It sounds like you think you would urge delay, and if so, for how long?
So the reason I think a delay is inevitable now is because, as I said, what we're seeing now in hospitals are extremely busy at the moment. And the emergency departments last month were the busiest they have been, for years, because there's a huge backlog of patients that didn't come in during the peaks, particularly the second wave, partly because they were worried about catching COVID and also because they didn't want to put pressure on the NHS. So having a huge number of people coming to the emergency departments, as well as dealing with this huge waiting list and backlog. And so even a relatively small increase in hospital admissions for COVID will have a significant impact on all our non-COVID patients, all our cancer patients, heart patients, etc. And we really can't afford, for those people to suffer anymore. They have already suffered enough over the last 18 months. So what I expect the Prime Minister to say is that based on that data, unfortunately, a delay is needed to make sure that we don't get to a situation again where the NHS is unable to provide care to all its patients. I mean, this slogan that we've had over the last 18 months of protecting the NHS, it's not about protecting hospitals or doctors or workers here. It's really about protecting our non-COVID patients. That's really the key. And that's what we need to ensure we don't get into that problem again. And the second point really is
so in essence, what you're sorry, so carry on.
No, it's okay. I was going to say the irreversibility really is key as well, as the Prime Minister has stressed. I think the worst thing for all of us and for the economy, for hospitality, for our mental and physical health would be to go backwards, to go back to before we were before step 3. At least with step 3, we're able to visit, family and friends and to meet and to go out, etc. So the last thing we want is to have to go backwards.
Do you think that there is any value in, for example, closing schools at this point?
No, certainly not. I think children have suffered hugely over the last 18 months. And one of the main things I've always stressed is that schools should stay open as long as possible. And I would have wanted them to reopen earlier last year. But the other point related to that is that if cases continue to increase, even without hospitalizations, that has a significant impact on the number of children in school. We saw in Bolton before half term, a third of children were off school. And certainly we don't want that to happen across the country. So by keeping cases as low as possible in the coming 4 weeks while schools are open, that maximizes the chance for all children to be in school until the end of term. And you asked me about the amount of time that's required for this delay. I mean, partly because of schools, partly because of what's likely to happen with the NHS. It seems that a 4-week delay would be optimal. It allows us to vaccinate millions more people, both with first and second doses. And the good news is that, in places like Bolton, we saw that where we increased vaccination and testing and people took more care, we were able to bring this third wave under control. And although hospitalizations did increase, it didn't get as high as the second or first wave.